Doc, what do the private hospitals need from government at this point, whether from the national government or the local government, especially the areas, as you said, na talagang walang anchor facilities?
Yes. Actually, aside from the health in the number of nurses, what the private hospitals are asking the government is to help us na in terms of payment of PhilHealth to the private
ngayon,
hospitals.
hindi pa nasosolusyonan yan, sir. Talaga, sa totoo lang.
Unfortunately,
Ang huli kayong nag-guest dito noong April, yan
Yes.
pa rin yan na yung
Yes, it's still a problem. Remember, private hospitals rely mainly on our patients. It's unlike the government hospitals. Government hospitals have a continuous supply or budget. Every month, nagbibigay sila ng budget, may pansweldo sila sa kanilang mga empleyado every month. But private hospitals, we rely mainly on the services we offer and on our admissions. And of course, contributory, yung funding na binibigay, supposedly na binabayad ng PhilHealth.
Yeah.
I'd like to give you an example. Let's say a 50-bed hospital na 20% allocation for COVID cases. So meron kang 10 beds dyan. Usually, what we admit sa private hospitals are the moderate, severe, and critical cases. A moderate patient, ang i-charge na mo dyan, ibig sabihin, ang benefit ng PhilHealth niya is, for a moderate, is 143,000 for the next 2 weeks. Okay. The patient will be spending more than that. But i-deduct mo na yung 143,000. Remember, if you have 10 patients, kung full ang capacity mo, for the next 14 days, that's 1.4 million. 1.4 million na in advance ng private hospitals. Then another 2 weeks. That's 2.8 million for 1 month. Yun ay in advance again ng hospital. If, then siyempre, i-apply namin for reimbursement. If PhilHealth will not pay us, and then another month, ganun na naman, ubos talaga ang funding ng
So,
hospital.
Doc, ulitin lang po natin, wala pa pong naayos dito because every time we have the Hospitals Association and we talk to them, this keeps coming up and then we talk to government and government keeps saying, hindi, naayos na, nag-usap na kami, naayos na, kahit partially may gumalaw na. I mean, what really is the progress here, if any?
Unfortunately, talagang wala. Especially yung COVID claims namin in 2020. 2020, that's more than a year, That's more than a year.
So
And
you're
then
talking here,
yes.
how much? I mean,
Yeah.
Well, in 2020,
28 billion peso debt?
yes, in December, that was 28 billion. But then PhilHealth is claiming that they have paid already, let's say, 20 billion or 23 billion. That's their claim. The problem is our hospitals are complaining, we have not received anything. Ano sinasabi nila na binayaran kami? Ganun eh. So, yun ang inaano namin. They want to have a reconciliation of our data with their data. They can always say, kasi minsan, they are showing na we have paid this much. But then if you examine yung accounts mo sa bangko ng mga hospital, wala naman dumadating na pera. Kasi every time na may marireceive mga hospitals, we have to issue official receipts. So yung claim nila, nasasabihin nila na we paid you ganitong billions. Then show us na we have issued receipts for that amount of money.
What would be a reasonable figure at this point? Magkano pa po ang utang sa inyo?
Well, actually, yun pa rin ang aming right now talagang we did another survey and yung sa initial findings ng Philippine Hospital at saka private hospitals, ang findings ng initial survey namin, only 4% nung ang nabayaran daw.
As of?
According to our hospitals.
As of?
Makakapag-settle niya, not independent body to settle the question. And na hindi pwedeng i-refute ng kahit sinong grupo. Na ito talaga yung, wala bang ganong klaseng body?
Mabang audit o third
Actually,
party.
supposedly, ganun, ano? But then, ang hirap eh. You know, even some hospitals nga are afraid to give out their data, ano? For fear of reprisal from the PhilHealth itself.
Oh, but
Anong reprisal yun?
hindi ka babayaran.
Pinahihirapan sila. Ibig sabihin, bigla silang sasabihin na papatuhan sila. This came from our hospitals, ano? Bigla sasabihin na ay kasi pinapupuntahan kami ng NBI kasi meron daw kaming ginagawang kalokohan, ganyan.
What?
Well, I mean, parang some form of harassment. Ano? But then, of course, that has to be proven. Kasi sa amin naman, if they have really a case for fraudulent things na ginawa ng hospital, then they should file a case against the hospital.